What's your first name?
I am Dr. David Gallegos with Modern Medicine AZ.
Beautiful.
And I've been using the Relax Sauna for about 2 years.
Okay.
For a lot of my patients that are really acutely inflamed, chronic inflammation, chronic infection patients. And what I love about the unit is that we can also have the IV running through them. So we'll start the IV before they got in the sauna. We'll kind of push the line through the little portal right here of the arm, and then they can get whatever IV protocol that we're using with them as they sit in here for, depending on the protocol that we're trying to run, which really helps to promote that vasodilation effect, anti-inflammation, and so they get even exponential benefits of what we're already doing. So.
And have you? How do the patients feel after they've got a before and after? They've done IVs without the sauna,
right?
And they do IVs with the sauna.
Yeah, I mean, they think. Well, a lot of the patients that they come back and they tell me their follow-ups, they're noticing a improvement in their symptoms that's lasting longer than just without the sauna, right? So they can stay, whether it's in remission of their symptoms, or they can feel better, more, energized for longer with the sauna add-on. So.
Now, what's the purpose of the IV?
Depends what we're trying to do, right, for the patient. So if it's a inflammation protocol that we're trying to do, if it's a immunity protocol that we're trying to do, that's sort of what we work on. But again, if they're not detoxing, if they're not mobilizing those toxins, they're not going to really feel better. They're not going to get that full resolution of their condition. So it is super crucial for them to be sweating, right, and to get the proper effect on that.
So how long have you been doing IVs in your practice?
For about three to 5 years now. And we do, everything from plaquex, so phosphatidylcholine for patients with soft plaque, cardiovascular inflammation patients, ozone patients in terms of, autoimmunity, chronic infections, but also for just patients in longevity, right? They want to keep their mitochondria healthy. They want to keep their cells healthy. They want to keep regenerating better. So those are the type of patients that we're currently using it for.
So the IVs actually work?
Yeah, they're phenomenal.
Now, the normal person like me as a mathematician, what is an IV?
So it's IV. The basic term is we start a solution that is medical grade, whether it's a saline solution or different minerals that's added to the solution, and then we infuse that solution with the nutrients that we're trying to give to the patient. We start that in a peripheral line, so in a vein portal in their arms, and then that's infused, over a certain period of time. And so it's the best way to get 100% bioavailability of those nutrients into the body. We're not going through the liver, we're not going through the digestion, right, in terms of absorption. So that's why it's such a benefit, for a lot of patients.
And what does IV stand for?
Intravenous solutions, right? So IV solutions. Yeah.
Right. And you were using them long before you heard of the sauna?
Yeah. Absolutely.
And what inspired you to use the sauna while doing IV and having the arm stick out?
Well, for me, it was those patients that, are really acutely ill or chronically ill. And so we're promoting that warmth and that vasodilation effect on their patients. So that's allowing those nutrients to really be absorbed into the mitochondria, into the nutrients, into the cells a lot better, right? Because the vessels are already expanded. And so those nutrients can circulate better through the body. I can get to where we want them to be delivered a lot smoother. So,
and how much more effectively do you think by putting people in the sauna while you're doing IV? How much more effective is that than not using the sauna?
I mean, that's tough to say, right? Because I haven't really done it, I would say, in like a lot of cohort patients where I can give you a number. But just, anecdotally, what I've seen and what I've heard, patients do tend to feel better for longer. When we add the sauna to it. And it doesn't have to be, 30 minutes, right? It can be, like we spoke about, 5 minutes, 10 minutes. But it's enough to create that environment so that the nutrients can really do their work and work as efficient as they can.
And after they do the IV, if they didn't do it while in the sauna, then they can do the sauna, and that will help too?
Yeah, absolutely.
Yeah.
Absolutely, yeah.
And you can also do it before they do the IV.
Before the IV. And that's usually better.
Yes.
Right? Because they're
Right.
vasodilated. We can
Yes.
get a peripheral access a lot of it easier, especially those patients that are
Yeah.
hard to get a poke or a stick.
Yeah.
And then, they go through the 5-10 minutes. I mean, I do have some patients that sit there for 30 minutes, right?
Yeah.
And, I mean, they're sweating.
Yeah.
But we're also hydrating them, right?
Right.
And so
Yeah.
we're kind of covering all the angles of that treatment. So
Now, Dr. Paul Anderson told us, he's the first one that told us he was doing it while doing IV.
okay,
I
great.
said, wow.
Yeah. No,
So did you know that he was doing them too?
No, I didn't. I
Okay,
did
yeah.
not know that
You
he
thought
was
of this on your own?
Yeah.
Wow. So you're creative.
We try to stay
Yeah.
as efficient as we can.
Great. Okay. Well, that's great. And this is the Relax Sauna you're talking about.
Relax Sauna, yes, is by far the best one in the market. All of their research or all of the materials that they have by far surpasses anything else in the market. So highly recommended.
And you couldn't do it in a wooden sauna.
Definitely not.
Yeah. And
Right.
and you compared this to other portable saunas?
Yeah, I mean, not personally, but
Yeah.
I've seen the data,
Yes.
right, on the other ones,
Right.
and it doesn't really come close to this one. And like I said, for the IV access is awesome, right? 'Cause,
Yes, it surely
the
is.
IV solutions have to stay in a certain temperature.
Yes.
And you don't want to increase the heat or the temperature on the fluid itself, right?
Right.
And so the fact that you can just stick your arm out and have at room temperature,
Right.
that solution being perfused to the patient is
Yeah.
awesome.
Great. And it's relaxsaunas.com is the website where they get more information about the Relax Sauna. And you have a clinic here in Arizona?
Yes, we're here in Scottsdale on Shea and the 101.
Okay.
The clinic is Modern Medicine AZ,
Yes.
and we speak Spanish as well for all our Spanish-speaking patients. And our website is modmedaz.com if you guys want to learn more information.
modmedaz.com.
Yeah.
Okay. And you have a phone number they can reach
Yes,
you at?
absolutely. It's 480-371-3690.
Beautiful. Yeah, we want to share the wealth or share
Yes.
share the knowledge, share the information
Excited.
with others. We're excited. I didn't even know you were using the Relax Sauna while doing IV, and so this is exciting.
Yeah, super
I
excited.
mean, more and more doctors probably would benefit. There are thousands of doctors who do IV.
Oh yeah, thousands.
And so you would encourage all of them to experiment with using it with the Relax Sauna.
Yeah, especially for their, certain cohort of patients, right? It's not for everyone,
Right.
like every treatment, but
Yes.
for the majority of patients, they respond really, really well.
Hey, thanks a lot, David. I
Thank
really
you.
appreciate it.
Yeah.
Relaxsaunas.com. This is Phil Wilson saying thanks so much for listening.